Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. ADHD criteria for diagnosis. If you suspect that you, your child, or loved one may have untreated attention deficit hyperactivity disorder, ADHD, you might be wondering if there are criteria for diagnosing ADHD. According to the latest edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, there are specific ADHD criteria that a person must meet to receive a diagnosis. /r/n/r/n very well. Ellen Lindner /r/n/r/n. In this article, learn more about the specific ADHD criteria that must be met for adults and children according to the DSM-5, as well as what types of healthcare providers can assist in diagnosing ADHD. Self-testing or lab tests can be part of making an ADHD diagnosis but are not enough to confirm it. /r/n/r/n. A healthcare provider can confirm or rule out an ADHD diagnosis with an in-depth interview and physical exam. However, diagnostic criteria vary slightly depending on whether the patient is an adult or a child. /r/n/r/n. To determine whether you have ADHD, a healthcare professional will complete a comprehensive assessment using the diagnostic criteria set out in the APA's Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the national standard for the appropriate diagnosis and treatment of mental health conditions in the United States. /r/n/r/n. Adults. If you're an adult seeking an ADHD screening, you must find a licensed mental health professional or physician, such as a clinical psychologist, psychiatrist, neurologist, primary care provider, or social worker. /r/n/r/n. Children. For children and adolescents ages 4 to 18, healthcare providers such as pediatricians, psychiatrists, and child psychologists can screen for and diagnose ADHD. /r/n/r/n. During COVID-19, many people living with ADHD experienced an uptick in distressing symptoms. /r/n/r/n. According to the DSM-5, people with ADHD have signs and symptoms of inattention and/or hyperactivity impulsivity that make it difficult to function on a day-to-day basis. /r/n/r/n. In order to be diagnosed with ADHD, children up to age 16 must often experience 6 or more symptoms of inattention and/or hyperactivity and impulsivity. Adolescents 17 years and older and adults must have 5 or more symptoms of inattention and/or hyperactivity and impulsivity. /r/n/r/n. These must last for at least 6 months in a life-disrupting way and be inappropriate for their developmental level. /r/n/r/n. Symptoms of inattention include /r/n/r/n. Symptoms of hyperactivity and impulsivity include /r/n/r/n. Additionally, the healthcare provider will also need to confirm the following for these symptoms for an official ADHD diagnosis. /r/n/r/n. To diagnose a child with ADHD, a healthcare provider will complete the following steps. /r/n/r/n. Depending on the child's symptoms, you may also need a referral to meet with a pediatric specialist for additional screenings for conditions like developmental disorders or learning disabilities. /r/n/r/n. For adults, the process of receiving an ADHD diagnosis is similar. During your visit, a healthcare provider will complete the following steps. /r/n/r/n. At the end of your appointment, your healthcare provider will share whether or not you have ADHD as well as other health conditions. After that, they'll discuss treatment options with you and, if necessary, refer you to specialists for further screening and care. /r/n/r/n. The gold standard diagnostic procedure for ADHD is an interview and physical exam to identify ADHD symptoms and other potential mental and physical health conditions. /r/n/r/n. Although you may have heard about various tests for ADHD, the condition cannot currently be diagnosed solely using brain imaging studies such as an MRI, PET, or CT scan. However, your physician may recommend blood tests, brain imaging studies, or an electroencephalogram, EEG, to rule out other health conditions. /r/n/r/n. While there are many self-assessments and questionnaires for symptoms of ADHD available online, most are not scientifically validated or standardized. Using self-assessments can't provide a definitive diagnosis, but it can give you an idea of whether it's time to seek help for a professional screening. You shouldn't use them to try to self-diagnose or diagnose others. Again, for a valid diagnosis, you must visit a qualified and licensed healthcare provider. /r/n/r/n. If you are curious about whether you or a loved one meets the diagnostic criteria for ADHD, you should see a healthcare provider to help you determine if you meet ADHD criteria. Mental health providers, primary care providers, neurologists, and other qualified providers can help diagnose or rule out ADHD. The DSM-5 lists ADHD criteria that must be met for a diagnosis to be made. Brain imaging, other lab tests, and self-assessments might be part of the diagnosis process but are not adequate alone to make an ADHD diagnosis. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.